Welcome back to another Research Connection. Today I'm here with Dr. Ronald Lee. He's an associate professor in our Department of Clinical Sciences, and his focus is emergency and critical care. So much of your research focuses on looking at the signaling mechanisms in inflammatory diseases. Can you talk a little bit about why it's so important to research those diseases or illnesses on a cellular basis?
Yeah, so my laboratory studies a cell type called platelets. And platelets, as you know, are important for forming blood clots. As we understand the cell type more, they are responsible for inflammation, they're involved in cancer. And so my laboratory looks at novel signaling pathway in that cell type so that we can develop drugs that can block these novel pathways in helping animals with different inflammatory diseases.
So there are a lot of health concerns that can affect pets as well as humans. I saw one of your publications on researching smoke inhalation in cats. Can you talk a little bit about cats or pets being models for human medicine and research?
Yeah, they're excellent models for human diseases. And you spoke of the wildfire cat study. At the time, I was in California, and I was lucky enough to be able to study their platelets. Animals and humans are exposed to the same environment. And so at that time, a lot of these cats were rescued from their cities and towns were burnt down. Fortunately, we're able to find out that cats, very similar to humans, also form blood clots when they're exposed to high amounts of pollutants in the air. So by studying them, we gain knowledge in how humans would react in a similar environment. Another great example of why we would like to study cats is also they are a naturally occurring great model for a heart disease called hypertrophic cardiomyopathy. And so far, out of all the species, we think that cats serve as a great naturally occurring model where we are able to study novel drugs and studying how we can prevent deadly blood clots, which also happens in humans as well.
A lot of cases that fall under emergency or critical care means that time is of the essence for veterinarians and doctors. How does your research translate clinically in those kind of emergency situations?
So as a critical care clinician and a researcher, one of my biggest passions is to bridge the gap between benchtop research and cage side. And so I will give an example of cats because that's my main area of research, is that one of my research focus is to look for a novel biomarker to predict clot formation in cats with heart disease. As you know, cats, once they reach the age of 7 and beyond, it's one of the most common diseases that they could have. And so clot formation is definitely one of the most devastating complications of heart disease in cats. Currently, the diagnostic tests to identify risk factors for clot formation in cats is non-existent. And so I would like to develop a novel test where practitioners can just simply run the test either on emergency or general health appointment to predict heart disease and clot formation in these cats. Speaking of which, because of my interest in platelets, I'm oftentimes contacted by referring veterinarians and owners when their pets or their patients have novel bleeding disorders. And so that led to the discovery of novel mutations that we found in 2 kittens so far in the past few years. These mutations affect platelets, which is my main interest. And these mutations have never been found before in cats. So to us, that's very exciting, and hopefully we can continue this line of work to help more feline patients.